have an advisory that is coming to the fore from the Indian Medical Association as well, who has now appealed to the public to follow COVID-appropriate behavior, especially in public, with immediate effect. Sharon continues to be with us, getting us more details, because now we have several state governments that are also closely monitoring the situation, putting in place several steps to ensure that we do not have a spiraling effect as far as COVID-19 cases are concerned. And Sharon, the latest advisory coming to the fore from the IMA.
Well, Poonam, this is in fact a situation where India is right now being proactive, and the proactiveness is coming not just from the government side but also from the state side, from different organizations like the IMA, the Indian Medical Association. Now they have in fact put out an advisory and are in fact appealing people to ensure that COVID appropriate behavior is followed in places, in different sections of the places, and they have in fact put out in fact a 8-point advisory which says that face masks are supposed to be used everywhere, social distancing need to be maintained, regular hand washing, public gathering like marriages and social meetings should in fact be avoided. Apart from that, avoid international travel, consult the doctor in case of symptoms like sore throat, cough or loose motion. Apart from that, follow the government advisory that is already existing. So we are seeing a proactiveness and alertness, not just from the government side but from different organizations, from different experts who all have been saying that we should not go back to the situation that we had experienced in 2 of the waves in the country. Right now we are in a very much better situation because of the natural infection, because of immunity, because of hybrid immunity, because of our vaccination coverage. Precaution dose is also something that needs to increase, is what the IMA has in fact been suggesting. So all these measures need to be taken so that we contain the infection, because right now the concern is of BF7, which is a variant that is creating havoc in China, and we have 4 cases of BF7 in India, and that is of course a concerning situation. But if we follow all the required protocol, all the guidelines, then the situation will be contained, the situation will not go out of hand, is what the experts have been suggesting. So similar kind of advisories is what has in fact been issued by IMA also, and we are seeing that there are in fact the existing guidelines that the government has been saying that need to be followed in everywhere. This big and small social gathering should in fact be avoided. The international travel should be avoided at the moment. So these are the measures that we need to take to ensure that the situation doesn't go out of hand.
Right, so several cautionary words coming in from different quarters. We had the Union Health Minister take stock yesterday. A crucial meeting was held, and today the Prime Minister is going to be holding that meeting at about 3:30 p.m. Sharon, do we know who all are going to be present in that particular meeting?
Well, of course, the health minister will be present. Apart from that, VK Paul, who is the health member of the Niti Aayog, will be present. Apart from that, there will also be officials from civil aviation, and there will be officials from DPT, which is the Department of Biotechnology. All of them will in fact be apprising the Prime Minister of the situation in hand at the moment. What are the measures that are being taken and can be taken given the situation that we had? Of course, we are in a very much better situation, but in coming days, could the situation get worse, or could there in fact be a situation where the infection spreads? So all these will in fact be discussed, and the Prime Minister will be apprised with the kind of guidelines or the proactive measures that has in fact been taken at the moment. So the meeting will of course start at 3:30 p.m. We have seen a similar meeting held yesterday at the Health Ministry,
right.
And today also we are seeing a number of state governments like Maharashtra, Delhi, Kerala are also in fact planning such meetings where they can take measures on ground, implement guidelines on ground to ensure that the situation doesn't go out of hand.
Absolutely, Sharon. Do keep a track of all that transpires there in terms of the monitoring that is being done at the central level and, of course, at different state levels as well. For the moment, thank you so much for getting us the latest. Dr. Kapoor continues to be with us. Dr. Rajesh Parekh also with me on this broadcast. And Dr. Parekh, as far as precautionary measures are concerned, yes, there are several advisories that are coming to the fore of masking up. But do you think that we should now make it mandatory, at least in certain public places?
Oh, absolutely. I mean, first of all, let me congratulate you on the excellent coverage so far, particularly that of Shireen and Anurima. They're very, very comprehensive coverage of the current situation. But the way the situation is going, your suggestion that, or implication at least, that masking should be mandatory in public spaces is, I think, appropriate. I have been masking for the last 3 years. I have not given up yet. Been following all the COVID appropriate behavior, more so as a physician, not wanting to be a carrier. But I think, given the alarming signals that are coming to us, not just from across the border, but from other countries as well, perhaps this is the right time to introduce mandatory masking in public spaces, given the festivities that are at hand.
Absolutely. And just a short while ago, we were discussing, Dr. Kapoor and I, about the precautionary dose or the booster dose. There are several misinformation campaigns that are going on. There are several doubts that are also being raised whether or not a third dose, a booster dose, as it's called, is even required.
Well, the best way to answer that is to look at the evidence. The evidence in our country, and of course from across the world, clearly indicates that those who have received the booster dose have a greater level of immunity, not only as indicated in their blood levels, but also in terms of their susceptibility to infections and the severity following those infections.
Right. And Dr. Kapoor, you must have also firsthand seen during the Delta wave, especially the kind of strain that was felt on medical infrastructure, on hospitals especially. If we were to ever be in that situation again, what are the kind of precautionary measures that hospitals on a personal level also need to be taking?
Oh, some of those precautionary measures are already in place. They got initiated during the Delta wave. I think all of us have learned from what went right and, of course, what went wrong in the earlier two waves. To give you an example, our hospital, the Jaslok Hospital and Research Center, has erected an entire building devoted initially for COVID, but now also for possibly other infectious diseases and pandemics to come. I think infrastructure has been ramped up everywhere. What we need to focus on is the availability of oxygen and the rapid deployment of staff and, of course, accessibility, equal accessibility to all.
Absolutely. And Dr. Kapoor, I want to get you in on that as well. As far as the infrastructure is concerned, especially at government hospital level, we saw the kind of crumbling of infrastructure that happened. And should the state government, should the centre wait for the situation to worsen? Or now that we have 4 cases already, should we already start putting those processes in place?
No, I think, yes, we should be geared up absolutely for that in case we get into that situation. But still, I think the biggest mantra is that we should not reach that situation and, have all the curves and balances in place right now and be very, very vigilant about people traveling from outside, whether they are diagnosed cases, any suspicious cases. We should first, I think, do, as I mentioned prior, we ramp up the COVID investigation. I mean, detecting the, diagnosing the COVID virus infection by checking it. So these are the measures which should be done now so that we do not reach that stage. Now, God forbidden, if we reach that stage, I think yes, it should be starting with all the proper planning to have dedicated ICUs and dedicated beds at government hospitals as well as the private infrastructural hospitals. Per state or per city, it should be planned in that manner. We should pick and choose that which are the more vulnerable sites and more vulnerable cities where the numbers are higher up. And in those, the local management should be very, very active to, dedicate those beds and ICU things and the paramedical staff. And then also my friend mentioned that oxygen availability. So all those things should be checked now, that whether if that situation arises in a month or 6 weeks, are we ready for that? But still, my whole focus is that we should do all the maneuvers possible not to reach that segment, because it's a hugely disastrous situation, and we have seen that in Delta virus thing.
Absolutely, and India is going to be better prepared this time around if the situation does reach that stage, which is why we have monitoring happening at individual state levels as well, and also at the centre with the Prime Minister chairing that key meeting in a few hours from now. I thank you both doctors for joining us here on this broadcast and